You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, look, if you have been told you are a loud snorer, or you have been diagnosed with sleep apnea, and you've been told you need a CPAP, and maybe you tried a CPAP, but you can't wear it because it's uncomfortable, or you just don't like it, we may have good news. With us, we have from Colorado, Dr. Taher Doon. He's getting amazing results with his patients with sleep apnea. Dr. Doon, welcome to the program.
Yeah, thank you for having me.
Good, good. And I know you have a training institute there. You teach dentists from all over the country. But for people that don't know your practice as far as sleep apnea, we've had you on the program before talking about dental implants, replacing missing teeth. But sleep apnea is a big part of your practice. So who's that typical patient?
Yeah, we actually have different groups of people who would qualify for sleep apnea treatment. We have the people who are getting sent to us by their physicians or who already have a diagnosis of sleep apnea and they can't wear the CPAP. And Randy, I don't know if you know this, but there's about 70% of people who have a CPAP who can't wear it. So the CPAPs work, but if it's just sitting there collecting dust, then obviously it's not working. So that's one group of people. The second group of people are the ones who are snoring, and their spouses or their significant others are bringing them into our practice because they can't sleep and they're worried about them. They hear them stop breathing throughout the night.
Is a little snoring okay?
Well, and it's logical to think a little snoring is okay because it's a sign of aging. Just like worn teeth, people think that's normal, or a little bit of gum bleeding and they think that's normal. But all of those things are actually abnormal, and all of those things need to be resolved. And it's always easier to resolve something when it's in a mild or infancy type of stage versus when it's moderate or severe. We have patients who are absolutely unaware that they have sleep apnea. The humans are very adaptive. So we just acclimate to this level of tiredness, and we think as I got older, I just have less energy. I just don't have the energy to go gardening or go work out, and we just think it's a sign of aging. So people are sometimes just completely unaware of what's happening every single night. And then we have the kids, and this is a new part of medicine and a new part of dentistry where we're finding apnea in kids. We all know what a tired kid looks like. I have 3 kids under the age of 5, and if they don't sleep or they don't eat, they're a different person.
Like they have attention deficit the next day.
Yeah, and that's one of the things. Like kids are getting diagnosed with attention deficit disorder, but it could just be inadequate sleep that's leading to.
Have you ever seen reversals in your practice with kids?
Every single day. My 5-year-old is going through treatment right now, and I'm seeing this every single day in my practice and in my own home.
Is that right? And I told you this. Look, I've had the program, the Wellness Hour has been airing for 25 years. And 25 years ago, dentists treating sleep apnea was considered a little crazy, right?
Yeah.
Now, the medical community has acknowledged, and now they in just about every book written right now about longevity, anti-aging, prevention, everybody's talking about sleep apnea, and they're saying find a qualified dentist. So how'd you get into this, by the way?
So first, I have numerous things that brought me to treating sleep apnea. One that kind of is like near and dear to my heart is when my father dropped me off at dental school 15 years ago. On the flight back, he had a severe stroke, and he always would snore, rumble the room. The classic. We know he has sleep apnea, but he never got it taken care of. He had to relearn how to speak. He had to relearn how to walk, and thank God he's doing great now. But then 10 years later, he had a massive heart attack. And then that was the wake-up call. Then we had some grandchildren, or he had some grandchildren, and he would do it for them. He did it so he could be present in their lives. But if you don't sleep properly, what's happening is the lungs aren't getting enough oxygen into the blood. The blood doesn't have enough oxygen, so the heart pumps harder every single night to pump less oxygenated blood to the body. Well, the brain's not getting enough oxygen as well. So there's a huge link between Alzheimer's, neurologic disorders, dementia, and sleep apnea, cardiovascular disease, stroke, and heart attack, and sleep apnea.
Because of what? These stress hormones? Because you're not sleeping.
Yeah.
Let's get that out of the way. So these people that have sleep apnea, you say could be waking up like 40 times in 1 hour.
Yeah, or more.
But they don't know it.
Yeah, so mild apnea is you're waking up over 5 times per hour. Moderate apnea is 10 to 30, and over 30 is severe apnea.
People are waking up 30 times in 1 hour?
I have a patient who woke up 160 times per hour,
And they didn't
severe.
know it. They didn't know it.
No, he still denies that he has sleep apnea, and we have the test, and we started treating him, and he comes in, I'm refreshed. I can go do all these projects that I never did. I can go out to dinner with my wife and not be tired. His wife came back and talked to us and was like, you know, Barry was this amazing man I married, and through the years he lost all this vitality, all this energy. We just kind of sat on the sofa because he never had the energy to go out, and now we're going to dinner. Now we have date night. Now we're going out with our friends. It's this amazing transformation.
Because he's sleeping.
Because he's sleeping.
So Dina,
Yes?
why is it very important to be kind to your dentist?
Is that important? I didn't even know that was the thing.
Well, it's because
Why?
they have feelings too.
Love you.
What is the dentist's favorite alphabet? Letter of the alphabet.
I don't know.
The K.
We all say, I think we all do this as well. We all complain that there's not enough time in the day to do all the things we want to do. But we all have the time. What we don't all have is we don't all have the energy.
And the
to do
motivation.
and the motivation to do the things that we want to do. Well, if you're sleeping properly at night and you're not waking up in the middle of the night, and I guess let me clarify one thing. You're not physically waking up. You're not like cognizant of the wake up. It's your body is subconsciously waking you up at night. So you could be completely unaware of how many times you're waking up, but it's disruptive on a neurotransmitter level, on a hormone level, from a neurologic level. The organs work harder. It's physically taxing to not be sleeping
So
appropriately.
when you get these people sleeping again, or at least breathing better,
Yeah.
so they're not waking up, do they all say that? How soon before they say, God, I feel better? Because we all know what it's like not to sleep.
Oh my gosh, yeah.
Because you're not motivated if you don't sleep.
Yeah. So I mean, so there's two ways to look at it. I'm going to go a little nerdy here.
Okay.
So we measure REM sleep, non-REM sleep, and we measure a bunch of different things. When the non-REM and REM sleep is close enough on the reporting, I could give you the appliance today, and you would come back tomorrow and say, the fog is lifted. This is amazing.
Have you had that happen?
Oh, we do consults. I do, I think, like 10 consults a day. We treat sleep apnea and surgery primarily in my practice. Now, we're a general practice, and we treat everyone from 6 months old all the way to 106 months. So we do everything in the practice. But for myself specifically, I do surgery and I treat sleep apnea.
Are they
because
surprised sometimes at the results?
They're shocked. And the beauty of it is their families are shocked as well.
Why?
Because so what happens over time is you see someone just slow down, and we think it's natural aging, like I said before. But then all of a sudden, it's like this reset button has been hit, and the patients and their families, they get to be a version of themselves that they always thought they could be, but never had the energy to be that way. And so what's the impact? Like, so Jeff, our patient, came in.
Yeah.
We did a reconstructive procedure on him. He's a 4-year-old kid. But what's the impact to that 4-year-old to have a father through his upbringing that's more present, that has more energy, that does activities with his 4-year-old?
Because he's sleeping again.
Because he's just sleeping and sleeping properly. It's not the quantity of sleep. You could sleep for 8 hours and be exhausted. It's the quality of sleep. So Jeff is having quality of sleep, which allows him to be energetic with his 4-year-old. So that 4-year-old is going to have a better upbringing and have better vitality because Jeff is a better father, because of the restful sleep he's getting by just wearing a simple appliance.
It's that big of a problem? I mean, that many people have this?
Yeah. So when it comes to the appliances that we're selecting, I mean, right now there's about
Appliance meaning the things you're putting in their mouths.
Correct.
Okay.
Correct. So there's about 140 different appliances. Well, what we need to know as dentists, as treating physicians, as the ENTs and the neurologists and the cardiologists and the treating dentists, we need to know what appliance fits that person specifically, because it's a customized appliance that needs to take into account how we're going to do that. That's where the tricky part gets. You need to know what person needs what appliance, and that is going to be the trick to resolve the issue and resolve it in a way where you're comfortable every single night wearing the appliance we're making for you.
You wear one of these?
I do. I actually have moderate apnea. So 9 years ago when I started treating sleep apnea, I would send people for tests. So I went and got the PSG at the hospital, the polysomnogram. I took a home sleep test, and you know, over the years, I went from no apnea, and then 5 years later, as we recommend everyone gets tested every 5 years, even if you have no apnea, 5 years later, I skipped over mild and went straight into moderate. And so from that perspective—
Meaning what?
Meaning I wasn't sleeping or I was waking up over 15 times per hour.
Wow.
And
Okay.
so, my team, they would have, because, I love my team, they're my second family. They'd put a sticky note on my computer with a smiley face or a frowny face. And, through the years, I started noticing I was getting more frowny faces. And I was like, I'm not showing up as the best version of myself. And, my team relies on me to be on point. My patients rely on me to be on point every single day, doing my best work.
Okay.
And as soon as I got this appliance in place, the fog was lifted for me. I was sleeping better. I was kinder and more empathetic and more fun to be around at the office. But here's the thing, and we both know this: you get a bad night of sleep, we're not fun to be around. People don't want to be around us. Like my wife married a very fun version of myself, and then to see myself get more miserable, it's like when we got married, I was in like this peak physical condition, and then if I let myself slip physically, that's not the person she married. Well, the same thing when it comes to energy. If you marry someone and they have this vitality and beautiful energy about them, and then that deteriorates over the years, everybody wants to be around someone who's fun, who enjoys life. And so that's what this can really do. And what I've done in my practice is I like to focus on the things that change people's lives. Like, no patient stands up and gives me a hug after a filling or a crown. But if I give them this beautiful surgery, this reconstructive procedure we do, or I can help them sleep better and become a better version of themselves, that's where the magic is. And that's why we have this generational change in our practice.
Allie, do you know why 8 was scared of 7?
Why was 8 scared of 7?
Because 7, 8, 9.
All right, knock, knock. Who's there? Interrupting Cal.
Interrupting Cal.
Let me get this right, just so I understand how this works.
Yeah.
So somebody is walking around all day, they're breathing just fine. They're okay. They lay down, they go to sleep, the jaw drops back, the tongue drops back, and you make a custom-made, you're calling it an appliance, that kind of opens up the airway. So
Correct.
they're breathing. Is that
Absolutely.
kind of how it works?
Yeah, when we go to sleep, everything relaxes. So think about the airway like a tube. Air goes in and out. So if something is obstructing the flow in the tube, the tongue goes back, blocks off the airway, tonsils are large, adenoids are large, nasal passageway is constricted, whatever the case may be, it's multifactorial. But whatever is causing an obstruction in the airway, so it's like someone's basically putting a pillow over your face at night. You're not breathing appropriately every single night. So if we can resolve that with a very simple, comfortable, easy appliance, then the airway's open, adequate oxygenation, the heart's working better, the brain's working better, your body as a whole needs to heal. Like, we call it recharging the battery. Every night, your brain heals and your body heals. So if there's underlying issues, like cardiologists now, if you have 2 medications for blood pressure, cardiologists are immediately saying we need to get the sleep addressed. If you're diabetic, there's a huge link between diabetes, cardiovascular disease, neurologic diseases, and sleep apnea. It's proven in the literature over and over again. It cannot be refuted. If people sleep better, everything as a whole will get healthier for you. And it's a very simple solution. You don't have to wear the mask and have the tornado or whirlwind in your mouth all night long. A simple appliance goes in and you breathe better every single night.
All right, we're gonna take a quick break, and we come back more about some of the, what diagnostic tools you're using to identify sleep apnea. You're watching the Wellness Hour. We're talking about the end of snoring and the end of sleep apnea. We'll be right back.
Dr. Doon noticed some chafing on my cheek and tongue and said that I grind my teeth during the night and that is a condition of sleep apnea. And I told him that I did have that, but I didn't know to what degree. And so he talked to me about, it's an appliance, they call it, and it shifts the back jaw back so that it opens up your airway and so that you can breathe through the night. Like I say, I knew that I had sleep apnea, but I didn't want to do a CPAP because it feels like you have a bug on your face or something, and I just didn't want to have anything to do with it. The exciting thing was about it is when the alarm went off in the morning and I got up, I wasn't in the normal fog, the cobwebs and like dredging to get out of bed. It wasn't there. I was completely alert. My mind was clear. It had been like I'd been up for a couple hours already. It was absolutely amazing. So if any of you have sleep apnea, you need to get this mouth appliance. I'm not kidding.
You know, it's funny. Another thing that Dr. Dune helped me with is actually my sleep apnea. For years, I was just really, really tired. Didn't know why. But as I was getting older, I was dragging more and more. He was able to create a jaw repositioning device that not only helped with my sleep apnea and lower how many interruptions I was having a night, but also helped with snoring. So I don't snore anymore. So really appreciated to Dr. Dune and his team for making that happen for me.
Why did the smartphone go to the dentist?
Why?
Because it had a Bluetooth.
So you have to act stupid, okay? That's not hard. What are the strongest days of the week?
I don't know. What are they?
Saturday and Sunday, because the others are weekdays. What did the dentist of the year get?
Not sure.
A little plaque.
My name is Jennifer, and I've had recurring cold sores in the same spot for over a year. They were stress-induced or cold-induced, anything like that. And I came in, and Kathy has done laser treatment on the cold sore one time, and I haven't had them come back since. And it's been several months now, and I just had a new breakout in a different spot, but I just got that done, and I can already feel that it feels a lot better. So I would highly recommend getting this done to anyone who has recurring cold sores.
What do dentists call their x-rays?
I don't know, what do they call it?
Toothpicks.
What do you call someone with no body and no nose?
I don't know.
Nobody knows?
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, for those of you that are suffering from or been told you have sleep apnea, or if your partner or spouse says you're a loud snorer, you got to hear what Dr. Dune has to say. So Dr. Dune, welcome back. So does it always start with snoring usually?
Well, oftentimes the snoring is a good indicator for people to come in and just get an evaluation. I think if you snore 100% of the time, you should get a sleep test. And so here's the thing, the spouses will oftentimes call us and make the appointment for whoever's doing the snoring. And it goes both ways. Now, in my practice, it's about 60% men who are having the sleep apnea treated and 40% women. So what we attempt to do with the spouses is they'll make the appointment for their significant other. You come in, we have a home sleep test, we do free consultations. You leave with the home sleep test, you get to sleep in your own bed, you don't have to go to the hospital and have all these electrodes put on you. Get a good night's rest at home.
Is it like a ring or what is it?
Yeah, so we have multiple home sleep tests now. So we have one that's as simple as just something that goes on your finger, just a quick ring that gets you a quick diagnostic result. And then we also have a test that has the nasal cannula, body straps, measures body position, how you're breathing, how many times you're desaturating or obstructing throughout the night. It measures your REM sleep, where the brain recharges, the non-REM sleep, where the body recharges. It's the technology on this has come so far that we get a lot of information where you don't have to go to the hospital.
Now, I haven't seen this diagnostic testing, but does it like have a readout that shows you from 1 to 3 and then 4 in the morning, you were stressed out, your heart rate was up, things like that, low oxygen levels, all of those things?
Yeah, it's really...
Does it show you that stuff?
It's really interesting you say that, because it basically prints out a graph and it'll show you, we can see when you snore, your oxygen levels decrease, your heart rate increases. It'll show us your body position when this is happening, because sometimes we'll talk about positional therapy. We just don't make an appliance and say, good luck. We have ways to say, hey, positionally, you may want to talk about this. Diet, we need to control inflammation. We need a healthier diet. Well, so what happens when you're not getting adequate sleep? Hormones are off. Well, one of the specific hormones that are off is one that makes you want to eat carbohydrates. When you're exhausted, you want to go after sugars. Well, what happens if you eat a lot of carbohydrates? You're going to put on weight. Well, what happens when you put on weight? Your apnea gets worse. It's this vicious cycle. So inadequate sleep will make you binge eat. because your body is telling you, we need energy, we are depleted, there is a sleep debt that needs to be paid here. And what's unfair to the spouse is they're waking up with you. If you guys are still sleeping in the same room, they're waking up with you. So then they're also having those negative hormones coming out. So it negatively affects both people in the room. And that's oftentimes why the husband is in a different room than the wife. Or
do you hear that?
All the time.
Like the snoring is so loud that they've got to sleep in the other room?
Yeah, I mean, I grew up with it. You know, my father snored so loud, you know, you could
really?
hear him through the wall. So oftentimes they would sleep in different beds. And the beauty of me getting into dentistry and my brother being an anesthesiologist and my mom being a retired nurse is we have a medical family. And so my mom treated children her entire career. My brother deals with the airway all the time. So we're all harping on my dad to get this treated. And as soon as we got him treated, the snoring went away. His energy level went up. They got back in the same bedroom. They got to like actually spend time together. He had this new vitality with his life. His jokes became more funny. His enthusiasm for life, the way he interacts with my kids, it's just so much more profound. So, and that's why I call it a generational type of treatment, is because I lived it. I have apnea. My father has apnea.
So that's why you're into it? Because you know, like, look, all of us, we find something that works. It's like, oh my God, I got to tell everybody about this.
Yeah.
Is that how you felt like when it worked for you?
Absolutely. And well, here's the beautiful thing about it is my patients feel the same way. So we barely have
to
to talk about
friends.
this. They tell their friends because, you know, a lot of people have friends who snore, just like a lot of people have friends who smoke cigarettes. And so it's like, if you have a friend who smokes cigarettes, you're like, hey, that's not good for you. Well, hey, guess what happened? This is how I quit smoking cigarettes. Well, this is how I cured my snoring. This is how I became closer with my wife. This is how I had more energy to go start that business or to go to the gym and work out. Or Charlotte, who's this beautiful lady, and she loves fried green tomatoes. And she just didn't have the energy to go and maintain her garden.
She said this?
Oh my gosh, I hear these stories all the time. And so now she has the energy because she's sleeping appropriately at night. She can spend time in the garden, make her fried green tomatoes. We still talk about that like every single time because it's what lights her up. So whatever in your life lights you up, you have the energy to go and pursue those things, whatever it may be.
Hey, Dr. Lundy.
Yes, Natalie.
Why do teeth move?
I don't know.
Shift happens.
So there was a man and a woman, and they were riding a train together. And this woman keeps looking at this man, and she tells him, oh, every time I look at you, I want to invite you back to my place. And he goes, oh, well, are you single? She's like, no, I'm a dentist. What does a moose get after drinking milk?
What?
A mustache.
And so how old are the patients? Like, what are the age range? I know there's young kids, children.
Yep.
Parents need to know about that. But are they in their 70s, 80s? Is
Yeah.
there a point where it's too late for this type of custom therapy with these appliances?
It's never too late. And even if you don't have teeth, because we're a surgical center as well, we can place the implants that are needed to restore your teeth to the way they need it to be so you can chew the healthier foods that your physicians and your primary cares want you to eat to, you know, ward off diabetes, improve the GI, help you be healthier. But then at the same time, those implants are going to help us to make the appliance to open the airway.
So people with like bad gum disease or currently wearing dentures, they have it too. So you can correct that?
Absolutely.
With what you're doing?
Absolutely. Okay. Because the beauty of what we set up at our practice is because we treat everything, you don't have to go to 4 or 5 different offices. So when I was growing up, I had to go to the general dentist, I had to go to the oral surgeon for my wisdom teeth, I had to go to the orthodontist for my orthodontics, and it was like difficult for my parents to drive us around to all of that and do all the sports and do all of this. It's like taxing for parents to have to take all their kids to all these different locations. So what we've created is a place where you can get everything done. The parents can get their apnea treated, the kids can get their apnea diagnosed at an early age to hopefully keep them from ever having to deal with the problems that we're talking about today. We treat orthodontics, we do surgery all in one place.
Because nobody likes going to the dentist, right? So it's nice if you could go to one place.
Well, I don't like being in the chair if I have to be in the chair. But because of that, we figured out ways to make this easy for the families and get everything done at the highest clinical level possible.
I got to back up because you offer the free consultation and the initial sleep test is free. And I was telling you off camera, there's a guy here in San Diego that charges $1,500 for that.
Yeah. I mean,
So-
that blows my mind.
That's nice though that you're doing that.
Well, I think it's a service. So the community has been really good to us, and what our job is as people who care for the community and being a pillar in the community is to make the barrier to entry for knowledge accessible. And getting these sleep tests, with the advent of technology, it's not expensive to do anymore. So I don't have to charge $1,500. We do the first consultation for free. We do your first test for free because A, I'm nerdy and I want to know the information. I need to have the diagnosis to treat people appropriately because the left brain in me needs the analytics. But also secondarily, there's so many people who need to have this treatment done and they need the knowledge to treat it.
In addition to them feeling better, them reporting they have more energy, do you show them the data, like a before and after?
Always.
That it's working?
Always. So we had this patient named Ben, this like really, really like amazing old guy, kind of crotchety sometimes, but still hilarious. You know, he's just like family in the practice. And so for him, he was always like, I'm Mr. Skeptical. You know, he's always skeptical about sleep apnea. So we did the first test. Then he had the appliance, and I had the second test. We pushed him from severe, because he would, you know, he's old and ornery.
What does severe mean?
Severe sleep apnea. He stopped breathing 40 times per hour.
Okay.
And he just thought that this was regular life. This is what age meant to him. And then after we treated him, he didn't even register with any apnea. He had only 3 events happening every hour. And if you hit 5 events per hour, that's when you're mild. So we took him from severe to sub-mild with 1 appliance and in 1 month. It was amazing. And then, of course, he wasn't skeptical anymore. I mean, Randy.
What happened? What did he say?
Oh, I mean, he was just like, I have all this energy. Doc, you were right. I like hearing that one every once in a while, especially out of the skeptical guys. But, you know, Randy, you interview medical doctors on your show all the time. What are they saying about sleep?
Yeah, I mean, just about every medical doctor it agrees, especially with integrative functional medicine, that you got to get checked for sleep apnea. And you also have to look for gum disease, which is one of the things you treat. I mean, but in every book, even the end of Alzheimer's, Bredesen talks about apnea is one of the contributing factors to Alzheimer's. Gundry, the heart surgeon that's writing all these books, get checked for gum disease, also get checked for apnea. So it's become mainstream.
Yeah.
And so more and more medical doctors across the country are just, and the so-called top guys all agree this is an issue. And they say patients, like, they don't want to take their advice. They'll listen to a bunch of other things. Oh, yeah, but I don't want to, you know, because they're asleep and they don't even know what's going on.
Yeah.
So that's your challenge too.
Well, absolutely. And another thing I want to bring up is, you know, people are living longer. So from a dental perspective, I have to make their teeth last longer. Well, we have to make the brain and the neurology be more functional at end of life.
Can we skip to kids for just a second? We have about a minute left. But so if your child, because you know, you're not sleeping in the same room with the child, so you don't know if they're gasping for air or whatever.
Yeah.
Is it, you just judge it based on how hard it is to get them out of the bed in the morning, or do they look tired?
Yeah.
Are there any signs that you could give tips to parents?
Absolutely. So like I said earlier in the show, I have 3 kids under 5. My 5-year-old actually has a sleep issue. So we are expanding his upper arch. If you expand the roof of the mouth, it's the floor of the nose. So you're making the nasal passageway bigger, so they're going to be breathing through their nose more. Well, if you breathe through your nose, it shrinks your adenoids and tonsils. So if the kids have small adenoids and tonsils, well, guess what? They can maybe prevent a very painful surgery to remove the tonsils. To answer the question you brought up for parents, if the kids are grinding their teeth, if the kids are snoring, or if the kids are having bedwetting issues, it means they might not be in a deep enough level of sleep, so then the bladder is not in a deep enough level of sleep, so the bladder is overactive. So these are the things to watch for. Or just your kid looks tired, they have bags under their eyes, or their mouth is just hanging open. All of these things are signs and symptoms of early onset sleep apnea in children. And here's the thing, with kids especially, they're going through such exponential growth curves, neurologically speaking, physically speaking, that they need good rest to become the best versions of themselves. They've linked IQ in children to 10 points, which is super significant if they get better sleep and adequate oxygenation of the brain. So I'm super passionate about getting these kids sleeping properly from a young age.
So final message, somebody watching this, and we talked kind of jokingly in the green room that we're dealing with a grumpy, skeptical, moody group of people that aren't sleeping. They think they're sleeping and they're not. So it's hard to motivate them to do this. What do you say to the person, maybe the spouse is watching this, the partner, what do you say to them? They've heard what you had to say, but they're skeptical.
Yeah, I would say it's just like someone who has bad teeth who doesn't smile because they're embarrassed of their smile. We confuse those people or those patients as unhappy people. Well, they're not unhappy people. We confuse people who are exhausted and who don't have energy to go do these things and spend time with their families as people who are just getting older or aging or having something going on. I think everybody owes it to themselves to figure out if there's something that can be easily corrected that can literally change the trajectory of their lives, but also their families' lives. And that's why we do the free consultation.
Good.
So I think it's beneficial for everyone to at least find out if this is something that could benefit them.
All right, good. I want to thank you for coming on the show. Always a pleasure. And if they want to make an appointment, they just go to the website.
Absolutely.
And see it. And you have a massive team over there, we should mention.
Yeah.
You're probably the busiest in Colorado for sleep disorders?
Probably at this point, we're the premier implant center in Northern Colorado, and as well as sleep apnea.
Good for you. Thanks again. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
Mikhail? Yeah. What's brown and sticky? Oh. Ew. Ooh, I don't know. A stick.
What sound does a witch's car make?
What?
Broom broom.
I was gonna say that too. I thought that too.
Jordan.
Yes.
Why did the king go to the dentist?
I don't know why.
He needed a new crown.
I think what Greeley is a place that you can come to one centralized location. You don't have to go to 3 or 4 different places in Greeley and meet 3 or 4 different doctors and 3 or 4 different teams to get everything taken care of, because we focus on the technology and we invest so heavily into the technology and the information and the newest techniques possible. And the most important part is actually the connection with the patient. It's taking the time to learn their story, learn who they're doing this for, why they're doing this, why they took the break from the dentist, the bad experiences in the past with the old school antiquated techniques that were getting done, the pain that they were caused. And when I see someone who's come in with a lot of failed dentistry, I don't view that person with any judgment at all. I look at someone who's really tried hard to get things taken care of, and they've just been unsuccessful for whatever reason. I want to see you 2 times a year. I want to see your kids 2 times a year. I'm going to see hopefully be doing this long enough where your kids grow up and I get to see them have their own kids. And that's the coolest part of this profession, is you can continuously be that pillar of the community and be present in their lives forever, or as long as I'm doing this.
What is another name for dentures?
I don't know.
Substitutes.
That's a good one. Hey. Hey. What is a dentist's favorite thing to do?
I don't know.
Netflix and drill.
What's a pirate's favorite letter? R. You think that, but it'd be the C.
Yeah, dental implants, I mean, man, if you asked me 10 years ago what dental implants were, I'd say it's a completely different thing. There's so many patients who walk in, they're like, oh yeah, you know, the implant I have up here, they had to pull the tooth and put a bone graft in, then wait 4 months, then place an implant, then wait 4 months, then make the tooth. That took a month, and it took like 8 or 9 or 10 months to get a tooth. And now we have 3D x-rays. And so when we have something 3D, we have a 3D rendering of the jawbone, where all the vital structures are. We know 100% where everything is, and you can even 3D print the model, which is the coolest thing, and you can do the surgery ahead of time before the patient ever comes in. So from the perspective of the technological curve that's occurred within implant dentistry and the improvement in the designs on how successful they are, it is night and day. I can place implants faster than I can do fillings these days. So I would equate a dental implant to an artificial tooth root that's there to replace one single tooth, or it can be there to replace several teeth, or it can be there to replace all your teeth.
Hi, my name is Gina. I work at Greeley Dental Care, and I do a little bit of everything. I'm an ortho tech and a dental assistant, but my favorite job is to get to assist you in every procedure with you. And just so you know, we do everything you can think of. Implants, crowns, fillings, orthodontics, expanders, sleep appliance, dentures, whatever you can think of. We probably do, except for a massage. We don't do that here, okay? What I like about the office is the environment we bring you in. So my job is to keep you informed of what's gonna happen during the appointment, and then also how to take care of yourself at home. Once you know what we did in your mouth, then you'll probably do a better job taking care of yourself at home. So what you can expect from me is just seeing me wandering around, and if you have any questions or any concern, or even if you just wonder how the office looked, come and take a look. Yeah, hold on. By the way, I forgot to mention, I do speak Spanish. So para todos aquellos que hablan español y tienen preguntas, muchas preguntas, llamen Greeley Dental Care, les podemos ayudar.
Sometimes when patients come here, you know, they can sometimes be overwhelmed with how much information we give them, and that's absolutely not the intent. The intent is to be as thorough as possible and looking at everyone from like a bird's eye view, you know, the 10,000-foot view. How do all the pieces work together? How do all the puzzle pieces fit together versus one tooth by one tooth by one tooth? And it's not to say that a dentist looking at one tooth at a time is anything wrong. It's just not the philosophy of this practice. So from our perspective, we're going to look at airway. We're going to look at the health of the teeth, the health of the gums, the health of the bone, how the bite fits together, how the muscles and the joints and everything work together. It's trusting your family with someone. It's trusting your health with someone. The fact that they show up year over year over year and they keep coming in and trusting us with that, it's a responsibility. It's a cool thing to see people come in over the years and watch them grow up or watch them grow older or more experienced and just be there on that kind of ride with them.
Hi, my name is Dr. Michael Lundy. I am one of the dentists here at Greeley Dental Care. I'm one of the practitioners that provides all of your dental needs, whether it be from exams to fillings and crowns, all of the other fun dental stuff that we have here. One of our core values that's the most important to me is that we trust ourselves and our teammates to do a phenomenal job with our patient care here. So I ended up moving from Michigan to this practice for a specific reason, because of the great work that I saw that was happening specifically here with Dr. Tahir-Dune's team. And it just means a lot to me to come here and to work with a team that not only functions at a high level, but I know that I can depend on them to do an incredible job. So that's very important for me, and ultimately that is something that our patients want to know, that they can trust us, that we'll do everything in our power to do the best job possible. We love seeing our patients here at Greeley Dental Care, and we're really excited to have you and be part of our dental family.
Our hygienists here are absolutely phenomenal, and I've been doing this for 10 years and I have never had this great of hygienists working for us all at the same time. What we do here that's a little bit different is we have all the latest technology and lasers and air polishers and glycine powder and different ways to kind of numb the tissue to keep you comfortable. We're doing all of those things through the hygiene department as well, and our hygienists are so gentle when they do the work, where patients will literally leave and be like, hey, that was like literally the best cleaning I've ever had in my life when they're new patients here. The hygienist's job is literally, I would say, arguably the most important thing that we do here, because the health of the gums and the bone, the foundation that we're building everything on. I can make the most beautiful veneer, place the implant perfect, but if the health of the gums and the bone aren't present, everything the dentist can do is all for nothing if it's not being maintained and handled appropriately with the hygiene department. From a dental perspective, we know patients don't want to be here, and so whenever I get to give a patient good news, it always feels good from my perspective too.
Hi, my name is Caitlin. I'm one of Greeley Dental Care's dental hygienists. I am super excited to be part of the team where I get to form lifelong connections with patients while educating them and helping them achieve optimal oral health. I look forward to seeing you in my chair.
There's something called phase 1 orthodontics that we actually want to talk about more often than not. If we can avoid someone losing good, healthy teeth by expanding their arches when they're younger, and we create adequate space for all the adult teeth to come in and not come in crooked. So when you expand and do phase 1 orthodontics, it makes the phase 2 component so much easier. From an airway perspective, we're looking at tonsils and adenoids, so we're getting ENTs involved at the right time and the right stage, because dentistry is not independent of medicine and medicine is not independent of dentistry. And so we do the Invisalign in-house, but we also do the metal brackets in-house, the ceramic brackets in-house. If you need the wisdom teeth out at the same time at some point within your orthodontic treatment, we're a surgical practice, so we do that as well. So we really tie in all the facets of dentistry, and we time it appropriately for a kiddo in regular brackets or Invisalign or any type of treatment.
Hi, my name is Adriana. I'm your hygienist at Greeley Dental Care, and I provide gentle, thorough hygiene visits.
Sleep apnea used to be, you're old, you're obese, and your neck is the size, of a tire, and you snore so loud you rumble the room. That's what sleep apnea used to be. Now that is still what sleep apnea is, but that's in a severe capacity. If you're not sleeping well at night, it's called obstructive sleep apnea, right? You fall asleep, the chin and everything relaxes, it obstructs the flow of air. So what does that mean for dentistry? Well, these are your upper teeth and lower teeth, and those lower teeth grind forward, that's opening your airway. That's why if we see grinding on someone's teeth, we're immediately getting a sleep test, because it could be subconsciously the patient is trying to open their airway at night. There's a guard we can make if these are upper teeth and lower teeth that gently pull those lower teeth forward and open your airway. Well, they also protect your teeth from grinding too. It's huge. On the days I wear the guard, I have energy in the morning, and I wake up at 4:30 refreshed, because it's not the quantity of your sleep, it's absolutely 100% the quality of your sleep.
Hi, I'm Kathy, and I'm one of the hygienists here at Greeley Dental Care. If your hygienist has recommended that you have scaling and root planing, what that means is that there are bacteria and toxins below the gum line that are creating disease and inflammation. So what we need to do is numb up those gums so we can go underneath the gum line and clean all that out so we can restore your mouth to health. I typically say it's a non-surgical approach. We don't want you to go down to the other end of the office where you're seeing the doctors to have some teeth removed because there's so much bone loss. We want to get to that therapy before that happens. During that scaling and root planing appointment, we use different ways to make the gums and the teeth numb. We use special instruments that go underneath the gum line very precisely to remove all that hard tartar, that plaque, that bacteria that's causing the disease, so that we effectively can help your mouth get back to that state of health. The other things that we do during that specialized cleaning, the non-surgical periodontal therapy that we call it, deep scaling, scaling and root planing, it's known by a lot of different terms, is that we have the capacity to use a laser. And a laser is a concentrated light, as you know, that we take underneath the gum line to decontaminate that pocket area, to sterilize it, to give those gums the best response and healing as we can. We also have the capacity to use a low-grade antibiotic called Arrestin that we can put down into those areas that don't want to heal, so that they have a chance to heal as well. What you can typically expect after that deep cleaning, the scaling or root planing, or what I like to say, the non-surgical approach to gum therapy, is that you will be numb for a little while after the appointment. So we want to make sure that you are very careful with what you eat and you drink until that numbness goes away. After that, during that first day, we'll ask you just to limit the foods that are spicy, probably crunchy, hard. We don't want you to have to go down and underneath the gum line to clean anything out, since we've just done that therapy on you. But usually after that first 24-hour period, things are back to normal and your mouth is healthy, and we just give you all the tools that you need to restore your mouth to the health that it deserves.
So the importance of technology, even if you go back in the day, you know, like the dentist I bought the practice from, they didn't even wear gloves back when he was practicing. Now what's happened with this whole digital era coming into place is, yes, we have higher magnification, but we also have all the printers and mills and scanners and 3D x-rays and all these things that tie into a nice little bow to make the patient experience that much more profound, that much more accurate. We're doing less dentistry in some circumstances because we're able to diagnose appropriately. And on top of that, we're letting people who have a problem resolve it when it's smaller, because the technology is allowing us to see more. So we're preventing more major things from occurring. From the perspective of technology, it only will make the patient experience better, more comfortable, more accurate, and oftentimes less expensive because of how it's getting implemented and how it translates over into me being able to do my job better.
After talking with hundreds of patients over several years, there are a lot of fears and a lot of worries that start to become reoccurring. One of the major fears and anxieties that we hear about from our patients is the cost of dental implants. There's no denying that these things are expensive. They really are a very nice car, just kind of parked in your mouth. The main thing that patients report back to us is that with dental implants, your quality of life is restored. There's no more worrying that teeth are going to fall out. There's no more fears about ordering certain foods at restaurants. There's no more worries that people are going to see teeth and think things of you, or see your dentures and think something negatively happened throughout your life. Dental implants really are the restart for your life.
My parents, young, my mom wouldn't let me get dental work.
I've had dental problems most of my life. I had braces for 5 or 6 years, and it seems like that's where a lot of it started. Mm-hmm. And I had a crown put on, I think when I was about 21, and I don't know if it was, not my good dental care, but I thought I was going to the dentist enough.
Funny, my wisdom teeth came in, and they came in sideways, so it pushed everything forward, and that started breaking teeth.
So I have a life history of abuse, trauma, and it's a given. I'm finding out I'm not alone. When they start falling out, I just It's like, yeah, okay. I went and did the denture thing, and they told me I had osteoporosis of the mouth.
And I had a bridge, and I had crowns, and then I had most of my back molar pulled out. And financially, I just couldn't afford it anymore, so I just kind of had to live with that.
When I got married to my husband, Hap, he got me my first dentures and stuff. His dream was this, and I lost him a year ago to cancer. So this is being able to fulfill what he wanted for me.
The breaking point for me when I couldn't take it anymore was when the pain wouldn't stop. I was doing emergency dentist visits probably every other week, and that was way too expensive, so I just had somebody remove them.
I wasn't gonna cry. Except my cheeks are all fat like a chipmunk.
Only for now.
Wow. They are beautiful.
Yeah,
my kids are gonna be so happy and proud.
That is so much better than dentures. That is so... Thank you.
Oh wow, it does look way different. And this is not it though, right? Like you said, you'll have to keep adjusting.
Temporaries, man.
Mm-hmm. That is insane.
Look.
Dr. Dune found out I was getting ready to graduate, and he had me teeth the day before graduation. I smiled so big. I can show you a picture. You can just pick me out of the crowd because I'm the one with the biggest smile. Because I wasn't just smiling for me. I was smiling for a lot of people that I represent that are just like me. So Dr. Dune didn't just give me my teeth, he gave me my life.
I'm a lot happier now because I can smile like that. I get a lot of compliments at work from my colleagues because I look better.
One of the most rewarding things that we actually do is the impact that these procedures can do for someone, because what I found over the past 10 years of doing this is it's not just teeth. When you can give someone back a smile and you know the teeth are failing, they've been through the bad part of dentistry over and over again, like failing root canals, infection, all of these things. When we can go ahead and hit the reset button and give you back this beautiful smile, there's confidence, there's enjoying the meals with your family. We get text messages of our patients with their family members at Thanksgiving dinner or out just having a good time. You don't have to think about what's on the menu and have to order soup and mashed potatoes because you're worried about something. You can go out there and live your fullest life and have these true connections with your friends and family. And that's why I really focus on surgery, is because we're able to give this back to our patients and give it back to people within the community and really have a lasting mark from a surgical perspective all the way through a good set of really beautiful teeth that function the way that they used to when you were 12. So give us a call. We're at Greeley Dental Care. Our number is 970-352-4242, and we're here to help.
One of the things I've noticed over the years is when patients come in, they're not usually doing this just for themselves. Some people come in, they're like, hey, it's my turn. Like the mom who has put all her kids through braces and now it's her turn to get her dental care taken care of. But what I've found is with patients with infection or failing teeth or maybe even just missing teeth, that they're doing it for a son, they're doing it for a spouse. A spouse doesn't want to see their significant other in pain all the time. Nobody wants to see their significant other showing up as a lesser version of themselves or being in pain. So that's why we focus not only on the patient, but the family. We had a patient named John who came in and he's doing this for his 4-year-old. And he shared with me, he's embarrassed to smile with his 4-year-old. And like, I have a 5-year-old, a 3-year-old, and a 1-year-old, and like, I'm holding back the tears because it's his moment to tell me his vulnerability, and I'm dialing into it. But it's one of those things as a father I share too. It's like, you know, I can't even imagine that feeling. And so when you have patients and you actually connect with them and you hear what's motivating them, then you can be there for them to help shepherd them through, you know, whatever dental process they need to go through.
I am so incredibly thankful for the amazing hygienists who are here. I absolutely trust each and every single one of you with not only our patients' care, but my care, my family's care, and I love you guys.
I want to do a special shout out to Kathy, Adriana, and Caitlin. I mean, first and foremost, I am so blessed to have you guys here.
I will say our hygienists are exceptional.
Kathy, you've been here since day one, and we've been through so much. The transition, what we've done, the growth, all the implementation. You always say some version of you're not good with technology, but nonetheless you learn it all and you implement it all and you do an amazing job. And I just want you to know that I'm super blessed to have you on the team.
What are our hands? We have the best hygienists around.
Adriana, I think one of the solidifying moments for me was during COVID when you came in and, you know, dealing with the extractions and the infections and just doing everything that was needed to get the job done during arguably one of the more difficult parts of my career. And I think for a lot of people, it was a very unique situation. So just to see how you kind of showed up to the table and helped the team first was really impressive, and I'll never forget it.
Step and you guys do a little dance.
We do the heart.
Happy Hygienist Week. I just want to say I love you guys all. Caitlin, Adriana, Kathy, you guys are amazing.
Caitlin, I'm just like happy our paths crossed again. I mean, you know, it's like we deviate at some point, and then all of a sudden philosophies that, you know, more in part on my end has kind of changed over the years, and I'm glad we realigned, and I'm glad you're back on the team, and I'm glad we're going to do some really, really cool things together.
To our hygienists, thank you for all you do. You are greatly appreciated around here.
Kathy, Adriana, Caitlin, we love you so much. We love our hygiene team. Thank you for chasing me around all the time.
Amazing hygienist. I love working with you guys every day. Kathy's probably the sweetest person I've ever met and takes really good care of her patients.
We just want to say thank you to the 3 hygienists that we have here. You guys are all awesome and so caring.
Super appreciative that you guys are here. If I don't say it enough, it's not that I'm not thinking it. My brain's always in 20,000 places, but I really do feel it. So appreciate you guys.
And action.
So the way that typically works is you go to sleep, we do oral sedation, and we do IV sedation. Now, when I say sleep, I gotta say that kind of like with the air quotes. So oral sedation, you're gonna be very relaxed, okay? That's the promise I can make you, because it's how your body is gonna metabolize the medication. There's no extra charge for oral sedation. I've been doing it, I'm licensed to do it for a very long time. It's very predictable. We actually just completed a pretty complex case yesterday with oral sedation. And sometimes it's easier if I just tell you, hey, you know, open up a little bit bigger. I got to get back, you know, all the way to the back for 30 seconds to make sure I can get this implant into the right location. Versus IV sedation, where the anesthesiologist comes to the practice, there's an expense to do that. We give you medications via IV and you're, you know, 100% out. So at that point, there's a big difference. You know, I know a lot of you guys are scared about dentistry. I mean, granted, like if I'm in the chair, I don't like being there either. So we have IV sedation for you, and it's a very, you know, logical thing to want to be 100% asleep, wake up like it feels like 5 seconds later, and have everything done. So we have that option for you, and we also have the oral sedation option for you if economics are maybe an issue. There's some people who just don't want to be asleep for whatever reason. You know, like 1 out of 100 patients come in and just don't like the thought of IV sedation, and if that's you, then we have another option to keep you relaxed. You're still awake, you're still in control, and but you're very relaxed, so you don't care about the procedure. You're not worried about it. You can turn off the analytic portion of your brain and just relax while we do the procedure. So we have a lot of different ways to get you from A to Z. I've never had anyone do oral sedation and not have a good experience with it. in terms of being worried throughout the procedure. You know, typically, you know, you remember me walking in the room and then you'll remember kind of being done with the procedure. IV sedation, again, you remember me walking in the room and then you remember us waking you up afterwards and telling you you did great. So the sedation options are an amazing aspect that we've incorporated into dentistry. We do sedations for people who have fear also, because fear can override a lot of this. And a lot of people are so scared about going to the dentist that that's why your teeth get bad, because then you're only waiting for things to hurt, and then, you know, you got to call the dentist, you got to get in there. So we totally understand why you are where you are, but just know that if you're listening to this video, just know that we have solutions for you that are going to get you through the process. In dentistry, A, we've never had this much technology. B, we've never been as good as we are today. And C, our office we've made that dedication to technology. We've made the dedication to incorporating everything we can to keep you comfortable.